The Ebola epidemic in West Africa reaches extreme crisis levels. This, according to the United Nations Children's Agency. Health workers in the region are barely keeping up with this virus. For the latest on the cases across the globe, we're joined now by CCTV's Sean Callebs.
Yeah, it has really gotten a great deal of attention everywhere. Ebola concerns are now gripping 3 different continents. The latest, a nurse in Spain has been diagnosed with Ebola, making her the first person to actually be diagnosed with the disease outside of Africa during this current outbreak. The nurse apparently contracted the virus after she helped treat a Spanish missionary and a priest who have been working in West Africa. And as you may imagine, a thorough investigation is now underway to find out whom the nurse may have had contact with. Meanwhile, in the United States, Thomas Eric Duncan, the first person to be diagnosed with the disease here, is now receiving an experimental drug. He remains in critical condition in Dallas. The director of the Centers for Disease Control and Prevention says Duncan has taken a turn for the worst. Officials say the 10 people Duncan definitely came in contact with and 38 who he may have had contact with are now being monitored. But so far, none has had a fever spike or shown any other symptoms. It is believed Duncan was infected in Liberia while helping take a woman suffering from Ebola to a hospital. This past week, fears of the virus possibly spreading in the United States reached a fever pitch. The White House is trying to assure citizens that there will not be an Ebola outbreak.
The United States continues to be assessing and reassessing the procedures that are in place to safeguard the traveling public around the globe, but also the American public here at home.
The American journalist, who is now being treated at a Nebraska medical center, believes he may have contracted Ebola in Liberia while trying to spray wash the inside of a vehicle in which someone had died. The Nebraska center treating the 33-year-old freelance cameraman, Ashoka Mukpo, is one of only 4 biocontaminant units throughout the United States.
He walked off the plane, gingerly waved to us as we saw him from a distance, wheeled into the room, and he, is tentative and frightened, but I think he's strong and his symptoms are not more advanced than when I talked to him before he left, which is a real relief to us.
And those are Mukpo's parents, and they apparently tried to talk him out of making the trip to Liberia, but he had spent 2 years working in Liberia doing relief work and couldn't be talked out of making that trip, Mike.
Very interesting. How will he be treated?
It's interesting because you heard his father say he was able to gingerly walk out of the ambulance once he was taken to the facility. Right now, he is undergoing all initial observations. Authorities, doctors, health officials have not made a determination. Clearly, one of the experimental drugs is certainly going to be an option. That is the same clinic, or same facility, I should say, that treated the other 2 U.S. citizens who contracted Ebola in West Africa and then were brought back, and they're doing fine now. So that could be down the road. And even though he walked out of the ambulance, he looked good, health officials say the worst is yet to come from him. It's still early on.
Interesting. I was listening to talk radio yesterday, which can get generally inflammatory in this country, but one of the announcers was like, the U.S. has got to do more. We've got to close our borders. There seems to be this kind of panic cry that's begun. How is the government responding?
Yeah, in many ways, it's not just talk radio or the media. I mean, the governor of Texas came out today and said, we have to do more about the borders. But I think a lot of people say that they are right. And today, President Obama met with a number of health officials as well, and they have determined that, yes, things need to be changed. They're going to change, quote, the protocol for people leaving West Africa coming into the United States. There'll be more checks and balances on that end and a lot more checks and balances once they're here. But what will those be? No one really knows yet. They haven't specified that. But Obama says things need to be improved, need to be stepped up. And a lot of it dates back to Mr. Duncan, the individual who's in critical care now in Dallas. He basically lied when he left the area, said he had not been in contact with anybody. He did not have a fever, did not have any symptoms at that time. So he was able to come and basically walk with impunity among people in Dallas, stayed with his girlfriend, other people at that house. I mean, that could have turned into a real tragedy.
Wow. Sean Callebs, thanks so much.